So I'd like to say how delighted I am to welcome Dr. Michelle Weiner, who is a spine doctor. Is that correct? Really?
Pain
That's
management.
your pain management. Yes, a pain management. And who's going to tell us about all kinds of interesting stuff you won't want to miss. She's got a PowerPoint, and I'm just going to tell you a little bit about her in her bio. She's a double board certified in interventional pain medicine and physical medicine and rehabilitation. She completed her residency and fellowship training at the University of Miami. She's a member of Florida's Medical Cannabis Advisory Committee, and her unique approach of personalized and preventative medicine focuses on empowering her patients to cultivate health using lifestyle and plant medicine. That's my jam. Yes. Her research focuses on using cannabis as a substitute for opioids in chronic pain patients and cannabis's effect on seniors with chronic pain. She is faculty and preceptor at Nova Southeastern University, in which she educates the medical students through shadowing opportunities in her office. Dr. Weiner is the vice president of Mr. Psychedelic Law, a not-for-profit with a mission of responsible legal reform on psilocybin mushrooms in Florida. Woo-hoo! She uses, okay, that's good though. I get the idea. All right. So, Michelle, would you like to say something before you start your PowerPoint, or you just want to get into it?
Well, I'll just say that my main goal is just to educate. And by that, I mean, what I'm presenting is in the context of a clinical environment. And I just really want people to understand the paradigm shift that's about to happen in medicine, going away from taking a daily dose of a medication to really getting in touch and connect with who you are truly as a person and personalizing your treatment option as opposed to the one size fits all that we're all used to. So I do have a lot of information, and hopefully it'll be exciting and everyone can be curious about the future. And Lana, if you have questions along the way, you could always stop me. So I'm going to share the screen and then, all right. So as you said, I'm a pain management physician and I practice in South Florida, and I have a lot of pain doctors I work with, but I do something a little bit different. And I mainly use cannabis and ketamine assisted psychotherapy as my two main treatments for chronic pain and for mental illness. So I'm going to start with this quote that says, if you don't know how to say no, your body will say it for you through physical illnesses. This is from Gabor Mate. And to me, what this really means is when someone has suppressed or repressed emotions or trauma, it can come out as physical pain or as physical illness. And so what I see a lot of is fibromyalgia, chronic fatigue syndrome, irritable bowel syndrome, things that there are not really objective findings for. And a lot of it has to do with adverse childhood events, as well as different attachment styles and things that may not be a physical tissue damage. However, it's actually more of a chronic emotional stress that is now showing up as physical disease. So the way I approach chronic pain is through a biopsychosocial lens. And the problem that we really have that we're all aware of is that we have 50 million people in the United States who are in chronic pain. We have an opioid epidemic. We have a mental illness epidemic. We have a lot of people that are depressed and addicted to benzodiazepines because of anxiety. And obviously this started before COVID, but that whole social isolation and disconnection didn't make it any better. And so now I'm going to present some research about what chronic stress can actually do to the physical body and how we can also use this for treating addiction as well. And so the whole type of medicine is really called consciousness medicine. It's very transformative, and it's new, and it's not really a one size fits all. And by altering our consciousness, we're able to change how we look at ourselves. We're able to say we're not just our pain. We are able to separate our physical or emotional disease process from our identity. So cannabis and psychedelics are what I'm going to be talking about today. They both have the ability to alter our consciousness, and they also have therapeutic and medicinal value. And I'm going to touch on something called the default mode. And if you guys haven't heard of the default mode yet, it's a part of the brain that holds your story or your personal narrative or your ego. It really is who you are. That's your default mode, or who you think you are. And so when people take psychedelics in a safe and supported environment, they're able to quiet their default mode, which means the whole story of who you are no longer exists. You're able to start off with a clean slate. And so that in itself is very therapeutic. And again, I'm going to touch on neuroplasticity. So we all need a healthy amount of inflammation and stress in our body. And the key really is balance. So too much or too little of stress or inflammation can cause certain diseases. Too much trauma as a child can also cause disease. Our lifestyle choices can also cause disease in our body. And so we really talk about the psychosomatic, that term, the mind and the body. But it was first actually called body-mind by Candace Pert. And I think body-mind actually is a better way of describing it, because I think psychosomatic has turned into a way of thinking people have some type of, neuroses or psychoses, as opposed to really understanding that it's the mind and the body that are connected. And all of the time, 100% of the time, the body and the brain are connected. And so the body mind, I like that term instead of psychosomatic. And so really, when we're talking about inflammation and stress, it's not just our physical biology or our mindset. It's also our behavior. And the way that we're able to deal with inflammation and stress, the resilience, has to do with our awareness, our connection to ourselves, to others, and to the universe, and our ability to adapt. And the ability to adapt is extremely important. And that's really the underlying premise of neuroplasticity. So I do want to discuss something called the endocannabinoid system. And I'm sure many of you have not even heard of the endocannabinoid system. When I was in medical school, I did not learn about the endocannabinoid system. And this system is a whole system in our body that we have known about for over 25 years. So they found that THC, the molecule in the cannabis plant, has some psychoactivity, obviously, and they discovered that in 1964. So so when people would use cannabis, there would be different effects, as we know. And so they had to discover what is in the body that the THC is binding to, and why is it causing all these effects. And so in the early 90s, they actually discovered that we have receptors that the THC in the cannabis plant binds to. And those receptors, the CB1 receptors, are in our central nervous system, our brain and our spine. And so the question really is, did we have these receptors to use the cannabis plant? Is that really why we have these receptors? And they discovered that we actually make a naturally occurring THC-like molecule in our body. And they called it anandamide, which means the bliss molecule. So we make naturally occurring cannabinoids called endocannabinoids. We have cannabinoid receptors, the CB1 in the brain and the spinal cord. The CB2 are more inflammatory in the immune cells in the periphery. And so the whole point of the system is to balance our neurotransmitters. And sometimes when we don't make enough of our naturally occurring cannabinoids, like any other vitamin or mineral in our body, we need to supplement with it. And we do actually have the cannabis plant as a THC molecule to replace what we don't make in our body. And so the whole purpose of this is just to explain the fact that we have an endocannabinoid system. We don't have to be scared of THC. We basically make it in our body. But when we have a symptom, it means that the endocannabinoid system is not functioning to its optimal ability. And that could be because of stress. That could be because another system in our body is not working well. That could be because we're on a pharmaceutical that's changing the way our neurotransmitters are being processed. And so this system is very important, and I think will give us a lot of answers. The other thing that's interesting is as we age, we make less naturally occurring cannabinoids. And so that's why most of our diseases and chronic diseases come later in life, because we're not able to balance our endocannabinoid system. That's why some studies show 1 milligram of THC a day can actually help optimize our endocannabinoid system, decreasing overall inflammation, keeping us in balance. So the endocannabinoid system is a master regulator. It really interacts with all of our systems, and it actually has this retrograde path of trying to keep us in balance. And it controls many things. It controls our motor control, learning, motivation, memory, pain, sleep, appetite, metabolism. And so it's an extremely important system in our body that now we're aware of. And I think it will give us some answers as to some of the diseases that we don't have current answers to, and also will help prevent chronic disease by using things like CBD and low amounts of THC. So we understand we have a huge problem right now with chronic pain and with mental illness. And so I just want everyone to understand that with chronic pain, I'm not just talking about physical pain. I actually put them together because chronic pain is really an experience. It's really the person's perception of pain. Everyone has a different pain tolerance, and everyone has different factors that have led them to the point of a person who has an acute situation and doesn't heal, and this turns into a chronic situation. And that's really the question, is why does acute pain, for example, you have a knee replacement, that your tissue, your body, your tissues, the inflammation, it's supposed to heal, it's supposed to decrease on its own. Why in certain situations do some people with acute pain or an acute stressful event, why does it turn into a chronic situation? And so it's very interesting to think about the fact that chronic pain is really an experience. There may not have to actually be tissue damage, but there's more of an emotional experience there. And I do want to mention the fact that there is a very good study. It's called the STAR-D trial. And the STAR-D trial showed us that the first prescription for an antidepressant is effective in only 30% of the cases. And as we continue to try different antidepressants on patients, they're less likely to be effective. So the concept of taking a daily dose of a medication to keep a condition in balance is really not accurate. What is happening is people are really numbing their feelings. They're becoming addicted to certain medication, and they're not even understanding the root cause of their pain. So depression is a leading cause of disability worldwide. We have a lot of people on antidepressants for 30 years now. We don't even understand what that is. That wasn't even supposed to happen. Initially, they were putting people on these SSRIs to treat their depression, and now people are just stuck on these meds, not really understanding if they're helping them or not, but too scared to get off because of withdrawal. So I really want to make sure everybody takes a look at these studies. So recently, July of 2022, there was a review of the serotonin theory of depression. And so we have this concept of a chemical imbalance. If you don't make enough serotonin, you're depressed. If you make too much dopamine or too little dopamine, you can have things like ADHD, too little dopamine, Parkinson's disease. So they're taking different neurotransmitters and trying to figure out if you're deficient in them, does that cause a disease process? And so they discover that that depression is not caused by a chemical imbalance. There was no evidence that there's an association between serotonin and depression. And so the whole hypothesis that low serotonin causes depression was basically just disproven in July of 2022. So now we have the challenge of explaining to patients who are depressed on these medications, not only why they haven't been working, but then what are we supposed to do with them now that we know there is no true chemical imbalance. However, we've created a chemical imbalance by putting them on antidepressants for so many years. And so these drugs like SSRIs, SNRIs, they target serotonin, yet 80% of our neurotransmitters are GABA and glutamate in the brain. And so stress really affects our glutamate signaling. And this allows for basically the opposite of neuroplasticity. What happens when someone is stressed is the neurons don't communicate well, they're not able to adapt. In chronic stressful situations, different parts of the brain are affected. If the amygdala is affected, that's where our fear response is. The hippocampus is where we store memories. Prefrontal cortex involved in executive functioning. So it's where the receptors are and where the neurotransmitters are that will cause the actual clinical symptoms. And so when someone is under stress for too long, it could be physical or emotional stress, this can lead to neuronal atrophy in parts of the brain. That means that the neurons are no longer growing. They're no longer communicating with each other. And therefore, people are not as motivated. And this is actually one of the main symptoms of depression. So the theory now behind depression is that chronic stress will cause neuronal atrophy in parts of the brain that are responsible for things like reward, motivation, learning, emotional processing, and that actually will lead to depression. And so what we need to do is figure out ways of maintaining glutamate and GABA and looking less at things like serotonin. And so when someone has a chronic stressful situation, there's a whole reorganization of their central nervous system, and there's this hypersensitivity to things. They may have more pain from something that may not be painful, or they may be in a constant state of fight or flight because they had a trauma and that lives in their body. And that's really the thing about trauma, is that it's first a body sensation and then it's a thought process. So there's certain treatments that I'm going to discuss to really talk about getting someone comfortable in their body, connecting them deeper with their body. And some of these conditions are like fibromyalgia, migraines, TMJ, IBS, chronic fatigue, PTSD, anxiety, and depression. All these conditions don't have any actual objective findings. You can't take an MRI or blood work and diagnose these. So they're all processes related to a decrease in neuroplasticity and this central sensitization, or a wind-up phenomenon that is occurring, causing this reorganization in the central nervous system. So this is a picture of me and Bessel van der Kolk, and I'm very proud to have met him. I did a ketamine training and he was the facilitator, and he wrote the amazing book, The Body Keeps the Score. And The Body Keeps the Score is like the Bible that, a lot of people live by, because it really teaches us how trauma and life stresses get stored in the body. And I explain this to patients all the time when they have physical manifestations of emotional or chronic stress. And the point is really that you can't treat a chronic pain syndrome with just a biomedical solution. You can't just do a pill or a procedure for someone who has years of lack of support or isolation, or has had adverse childhood events in the past. And so I want to discuss ketamine. And ketamine is technically a dissociative anesthetic. It's not technically a psychedelic. However, it's a Schedule III drug that is a pharmaceutical that we are allowed to use right now. It's been used for over 50 years. It was used initially in the OR as an anesthetic to put people to sleep. And then they discovered when they woke up that they were actually less depressed. So Yale started about 20 years ago, started researching ketamine for depression because its effects on glutamate, the most popular neurotransmitter in our brain. And they found that ketamine can actually cause neuroplasticity. And if depression is really related to chronic stress and atrophy of the neurons in the brain, then perhaps ketamine can wake up parts of the brain so that people are able to feel better and give them an opportunity to make changes and develop positive thoughts and behaviors. And so they discovered that ketamine is a rapid antidepressant. If you get it through an IV or an intramuscular injection in the office, within hours, you'll feel better. However, one injection of that will only last about 7 days. And that's why the protocols now are doing a few sessions of ketamine in a short period of time as almost like a cumulative snowball effect, that you're trying to get a lot of the neuroplastic changes early on, and then doing this with what we call the therapeutic alliance, which is the therapist, the doctor, the coach, and making lifestyle changes will then have durable and long-lasting effects. And so this is an example of what a ketamine experience looks like. You're wearing eye shades, headphones, you're in a recliner, you're listening to a playlist, and you are basically having a beautiful journey inside the office. Everything is monitored, and the most important thing is that you feel comfortable and safe to let go into the moment and out of your conscious mind. So there's a lot of preparation that happens prior to the ketamine session. We have to focus on specific intentions. And the goal is really for the person to broaden the lens, for them to see bigger than what they have been just focused on in the past few months or years of their life. And it's almost like witnessing yourself. It's a dissociation. Dissociation means that it feels like almost your energy or your soul is leaving your body and traveling through time, through space, almost like a third person experience, which can be very therapeutic for someone whose physical body is in pain or who's had a lot of emotional distress. They're able to almost leave their body. And so there's almost the dissociation almost causes a reconnection with themselves, because they're able to third person themselves and actually be outside for a little while. And this really is the concept behind neuroplasticity. We're able to reorganize the brain region so that other parts of the brain that were normally not communicating are now able to communicate. And in certain neurodegenerative diseases, neuroplasticity is a huge problem. This is what causes the loss of cognitive function as we age. And as we live longer than we're used to living, we really need to focus on things to increase neuroplasticity. And one of the main mediators is something called brain-derived neurotrophic factor, which is increased with many different things like exercise, learning new languages, playing music, and as well as using ketamine and psychedelics. And so the interesting thing with ketamine and other psychedelics is there's a biological mechanism, a functional mechanism, and a psychological one. Ketamine, obviously, its effects on glutamate and the NMDA receptor, but also increasing this brain-derived neurotropic factor. That's just the biological one. Then we have the functional one where we're dampening the default mode. So people's thoughts about themselves, I'm not good enough, or I'm a bad person. All of these stories that they have about themselves lives in this part of the brain. And when you use ketamine or a psychedelic in a supported and safe environment, that part of the brain is quiet so that you could really have a new way of looking at yourself and get rid of what lives in your default mode. And then the psychological mechanism is the insight gained during these experiences. Perhaps they relive something and don't have such an emotional charge behind it. It allows for them to really have a new opportunity or a new perspective in how to look at their life or look at a specific situation. So there's all different routes of administration. IV, intramuscular are probably the most common in the office. And so I want to also differentiate ketamine from the classic psychedelics. And the exciting thing is that even though we right now have some problems with what looks like not great solutions, there's currently a lot of research going on through a big organization called MAPS, Multidisciplinary Association of Psychedelic Studies, where they're looking at things like MDMA for PTSD, or psilocybin mushrooms for treatment-resistant depression. So they're really bringing together science and spirituality and having an entire paradigm shift of how we practice medicine. So here, this shows some of the research over the past 10 years or so, and how the amount of studies with psilocybin and MDMA and LSD has significantly increased over time. And these currently right now are illegal. They're Schedule I drugs, but I do want to mention them because the way that the process is going is there's different stages of getting a drug FDA approved. And so right now, MDMA is in phase 3 for PTSD, which means that if that actually shows it's safe, effective, and has long-lasting effects, you could potentially go to your psychiatrist, your pain physician who has been trained in MDMA-assisted psychotherapy, and through insurance in a year or two, do an MDMA session with your doctor and therapist that would be covered by insurance. So that's a very big step for medicine. Same thing with psilocybin for depression. And so the psychedelics work differently than ketamine. Ketamine, again, is a dissociative anesthetic that works more on the glutamate neurotransmitter. These psychedelics, the classic ones, they work on the 5-HT2A. It's a serotonin receptor, and it also is involved in neuroplasticity. And so this is a very well-known picture, which shows that this is basically a picture of someone's brain. On the left, it's the placebo. It's just regular brain showing different connections that are happening with no medicine. And then when you give someone psilocybin, there's this entropic state. There's this increase in connection and communication between different brain regions, and also a decrease in that specific area called the default mode. And that's why people have something called an ego disillusion, because their ego is no longer in the front. So they're able to really not consciously think of their story and the reasons why they believe they are who they are, but actually have this clean slate so that they have time to change the way that they think about themselves and redirect their behaviors. And these are the classic things that people say that they felt during a psychedelic experience. Transcendence of time and space. The word ineffable means that they can't even describe it. After someone has a ketamine experience, they have this afterglow effect where they've never felt so happy, so free, so in love, so peaceful. And imagine living in pain or living with depression for so long and all of a sudden getting a break from that. There's this disruption that happens in the brain and they feel a positive mood. It's a noetic quality. They've never felt it before. They can't compare it to anything, a sense of sacredness, and then unity and oneness to all. That's very common. People feel connected to to nature, to the universe, to something bigger than them. There's something that they're aware of, instead of just being stuck in that narrative of this is my identity, this is my life. They realize that there's so much more. And so this is a classic example of someone going down the same ski slope every single day. The way you were yesterday is the same you'll be today and tomorrow. When you take a psychedelic, again, at the right dose, with the right intention, in the right environment, you're able to make a new path for yourself. And this path allows you to have opportunities and possibilities that you normally wouldn't have seen or felt without these medications. And so I'll just finish up by discussing a little bit about the cannabis plant. Cannabis, again, I talked about it mainly because I wanted to touch on the endocannabinoid system, but I do want to make people aware that the actual plant has almost 500 components. We're just aware of that THC and maybe CBD, but there's 150 cannabinoids. And then there's this other part of the cannabis plant called the terpenes. The terpenes are like the essential oils of the plant. They're like the steering wheel, and the THC is like the is basically like the batteries. It's driving everything. But where we're going, if we're going to sleep, if we're going to be happy, if we're going to get energy, that has to do with the terpenes or the essential oils. CBD, a lot of us are aware of. This comes from hemp. This comes from marijuana. Marijuana is the same as cannabis. And CBD doesn't have any psychoactivity as does THC. And the main benefit of CBD is that it allows us to increase our naturally occurring cannabinoids. So by taking CBD, we actually help our body stay in balance. The other nice thing about CBD that a lot of people don't know is that when you use it with THC, it competes, and so THC binds less strong. So if you wanted to use, let's say, a small amount of THC without the psychoactivity, you would use CBD with it in a higher ratio. And that's very common for people who have chronic pain. They'll take a 3-to-1 ratio or 5-to-1 ratio of CBD to THC. And these are an example of the terpenes. The terpenes are really what's going to give the anti-inflammatory effect, the anxiety effect, the anti-anxiety effect, the pain relieving effect. It's the synergistic effect, what we call the entourage effect of all parts of the cannabis plant will give it more of a benefit than just the THC alone. So cannabis does obviously affect our brain if the cannabinoid receptors are located in our brain. And I just want to mention that we do understand that THC can have negative effects if we're using too much of it too often. It can compete with our naturally occurring cannabinoids. It can also have negative effects on our working memory. But there have been studies that showed someone who had a traumatic brain injury who was positive for THC on their urine drug screen when they were admitted to the hospital. It actually had better outcomes because cannabis is a neuroprotectant. It can reduce inflammation. It can prevent neuronal cell death. And it also helps treat sleep, which is very important in things like PTSD, where they're recovering from these negative experiences. There was one study showing, and this was done in mice, but it showed that so basically a low regular amount of THC, let's say 1 to 2 milligrams, can actually slow down, help keep the brain from slowing down. What they showed was that younger mice, so we don't give THC to anyone until their brain has formed. That is something that we are all very well aware of. In younger mice, they had a performance drop when they used THC. In older mice, when they used a small amount of THC, there was a performance boost similar to younger mice who had no THC. So the point is, it's really about the dose and the frequency. If you're using too much THC, it can compete with our naturally occurring cannabinoids. It can affect memory. High amounts can cause psychosis. However, a very small amount may actually be a neuroprotectant. So I believe this is almost my last slide, but there's many important effects of psychedelics. It can widen our window of tolerance. And what I mean by that is if someone is having a past trauma and they're triggered often, it can help them reprocess it. It can help them feel compassion for themselves, feel grateful and have gratitude, be less have less self-criticism, which is really important for someone who has gone so long with pain or depression and how it affected their whole family and quality of life. It also is a tool to be used during therapy, and it gets to the root cause. A lot of people don't know where their depression comes from, and they'll use ketamine or psychedelics with therapy, and they'll understand the root cause of their disconnection. It also helps with stress resilience. And in general, what we've been talking about today is this concept of cognitive flexibility, the fact that the brain is malleable, the brain can change, and also the fact that our thoughts can change, and our thoughts are not always true. And so it's important that we connect with ourselves, that we're aligned to, that we know who we are, and we understand our identity is not defined by our disease process. And some diagnoses that we have, we're able to reverse. We don't have to have chronic pain forever. We don't have to be on opioids or antidepressants forever. A lot of it really does have to do with chronic stress. So this whole concept of consciousness medicine, I think, is really coming forth as the future of mental health. And it's interesting how in psychiatry, it seems like once someone gets a diagnosis, there's no cure for it. They have that diagnosis forever, as opposed to looking at curative psychiatry. This involves lifestyle changes, therapy or coaching, and perhaps using one of these psychedelic medications so that we can understand that body-mind relationship. And I'll just end with another quote by Gabor Mate, which is, "Every human has a true, genuine, authentic self. The trauma is a disconnection from it, and the healing is the reconnection with it." And I think that is all I have for today. The first one is, what are your thoughts on GABA Calm? Well, I'm not sure if that's a brand or a specific supplement, but I am a big fan of GABA for anxiety as well as for sleep. That is something I definitely recommend. GABA is the most common inhibitory neurotransmitter in our body. And so it's a natural way of helping people feel less anxious and also helping people sleep. So I do like GABA. So the next question is, would ketamine help with seasonal affective disorder or someone having anxiety? It's a great question. So I really believe that's an interesting one, because seasonal affective disorder is usually someone who's in the winter or cold or rainy environments and feeling depressed. So you actually know what the root cause of that is. I believe, things to enhance your overall activities of daily living would be more important, because you know what the root cause is, which means how can you find a way to exercise? How can you find more sunlight, let's say? I think that ketamine can be almost like a crutch for someone in that state, and it would definitely help, but I wouldn't want to start that process, because then you're going to be using it every time it's winter, right? So it definitely can help, but the purpose of ketamine is not just to is really to get to the underlying root, and what the root is here. So it really, I would say, of course, it could be helpful. It's right now we're using it off label for a lot of different things. Same thing with anxiety. It's not truly indicated for anxiety. It's more for treatment-resistant depression right now, but it definitely can help with anxiety and chronic stress. Do you treat patients with Alzheimer's? I actually do, and I think that patients with Alzheimer's are very interesting. I actually use cannabis to help them sleep, to help them during sundowning, to help them with anxiety during the day, usually a higher CBD to THC ratio. However, I've really seen that they are less sensitive to THC, and it's kind of like a paradoxical. I had a patient the other day that they were giving her 10 milligrams of THC before bed, and their mom was just waking up 2 hours later, and she would start painting, and she would start becoming more productive. So sometimes you have to be careful, but it's always start low and go slow and see how they respond. It's just that in the Alzheimer's population, it seems like it wakes them up in a different way than we're used to with cannabis. How is it determine the right amount of these alternative substances? What type of assessments are done? Can you put the last slide up? So we do, so again, ketamine is the only thing that's legal right now. All of the other psychedelics are not legal, so I do not use them. The way we determine it is if they've tried and failed multiple things. If they've already seen a therapist, if they've been on antidepressants, usually that they have to go through that process before we offer something like this. But nowadays, there's a lot of people who actually just don't want to take medication. They've already tried therapy, and they want to do more of a coaching lifestyle type of treatment plan. And so we use ketamine in that sense, a little bit different. And the assessments, we do baseline outcome measures. So like PHQ-9 is for depression. We do baseline assessments, and then after every few ketamine sessions to see if they're getting better. And every single person who gets ketamine is working with a therapist or a coach. Does THC help with heart irregularities? No, it's actually the opposite. THC can cause arrhythmias. It can increase your heart rate. That's actually a normal side effect. If you take too much THC, it can cause palpitation. So, it's always start low and go slow, but I wouldn't use THC to treat anything cardiac related. I can definitely share the slides with everyone if you want. And do you recommend brain scans before treatment? I know Dr. Amen is really big with that. I don't recommend brain scans because I'm not doing brain scans afterwards, and that would just be extremely expensive, and the insurance probably wouldn't cover that. Yes, cannabis is legal in Canada. And how about ketamine and Alzheimer's? Yeah. So I actually had one patient who has Alzheimer's that we used ketamine on for his depression, and it helped short term, but there wasn't a lot of maintenance and follow up, and so it's just a different, difficult population. I would say I would use CBD or perhaps cannabis more in that population than psychedelics. And I think we did all the questions.
Just one or two things I'd like to say. First of all, that DOs like Dr. Michelle are a lot more holistic and conscious in their medicine, I have found, as opposed to MDs, right? Would you say that's true?
I would. I mean, that's what we're taught. We're taught to look at the whole person, not just to look at the disease process or the symptom. So
that's the kind of doctor I would definitely recommend. I also wanted to say that for people who are listening to this, who think that cannabis is the only thing for the endocannabinoid system, that's not correct. You can actually, just like with BDNF, you can increase your BDNF and you can strengthen your endocannabinoid system almost with the same things, where it's, the foods are chia seeds, flax seeds, walnuts, sardines, anchovies. By the way, anchovies are super brain food, just so you know, and they don't kill the environment either. They're not harmful to anything because they're just in their own little places. I had a whole lecture on that. And pasture eggs that have been pasture fed. And then also the other things are activities like acupuncture, meditation, yoga, breath work, enjoying your exercise. Because that's
right. That's good that you know that, because there was a study done showing that when you exercise, if you're not enjoying it, it doesn't increase your endogenous cannabinoids. And that's really the concept behind the runner's high, is that it's not just the endorphins that are elevated when we exercise, it's the endogenous cannabinoids, which are also made from all the foods you just stated, and things like meditation and breath work. So of course, it's more than just the cannabis plant.
Yes. I just wanted to make that point, even though, the subject was the cannabis plant and psychedelics. So I want to thank you so much, Michelle, Dr. Michelle, for your wonderful presentation. And I'm really honored and delighted that you joined us today.